hard to know what a program is really like when you're doing all this virtually.
You're going to find a program that just clicks with you, and you'll know.
The residents are the main reason most of us have chosen the program here.
The people, they've just been great, so supportive, understanding. The teaching methods, I think, are fantastic here.
You can't see the culture through a video. And I think that's going to be the hardest part, is like you're not really going to be able to, we're going to try our best, but to see the Cincinnati culture and what a family that we are.
I think it's really important that students, have a good sense of knowing what they want in a program, what type of people they want to be surrounded by for 7 years.
The operative experience here starts early. It's often.
I think we have a lot of opportunities, with assigned rotations to get a lot of exposure to different cases early on.
Our working relationship with our attendings is awesome.
The attendings are really great about teaching and serving our residents.
All of the faculty who are here actually want to be here. They actually want to teach residents. They take the time to do that.
It was a very nurturing environment. I felt like I wasn't afraid to branch out and ask questions, because I knew they would answer them very kindly and teach me even more things than I was asking for.
And we treat it like a family, and so anyone who comes here is going to be welcome just like any other family member.
What does life look like in the Cincinnati region? Well, with the cost of living, pretty much any way you want it to. Live by a river, a park, a forest, a castle, a spaceship, on bluegrass, or in the urban core. And fill your days and nights with farmers markets, rooftops, parks, bike trails, festivals, and a world-class art scene. Fall in love with some of our favorite things like craft bourbon, craft beer, chili on spaghetti, and Oprah's favorite ice cream. Not to mention all of our incredible views. Work at some of the world's largest headquarters, cool startups, or build your own thing. We're a big city with a small town feel. Just a cup of coffee away from meeting your next whoever. As you imagine what's next for you, try imagining it here. The place where dreamers who dream manifest into doers that do. This is life in the Cincinnati region. A beautiful collision of culture and access to everything and everyone you need to build the life that you want.
This is kind of the perfect setting. You have access to sports teams, arts, there's a great food scene here.
Everything's a little bit more accessible and easy to get to here, but still having all the amenities that a large city has.
Those, I really enjoy the youthful energy that Cincinnati brings.
It has a kind of little big city vibe where, there's a lot to do, but it's not overcrowded.
Great food scene. Great brewery scene.
The food scene's fantastic. I love to cook. My wife and I love to cook. So coming here, we were pleasantly surprised with how different restaurants, eclectic food options and things like that.
I really liked it because it reminded me of home in South Carolina. The landscape here is beautiful.
Cincinnati has pleasantly surprised me in terms of there's a great park system. They've rebuilt the downtown area. I actually live in northern Kentucky, and that's all being renovated as well. So there's no shortage of things to do in your limited time that's available as a resident. But when you have that downtime, it's easy to get outside and do things and kind of everything you really want in the city without being too big.
Sports are definitely king here. Baseball, soccer, football.
It's a medium-sized city with big city amenities. We have excellent arts, sports venues.
And then the hospital system is just historically such a strong surgical hospital system in both emergency and neurosurgery, in general surgery, and we all interact as teams in the hospital together. So there was a lot of historic importance Cincinnati had as well in medicine.
The chili I do actually think is terrible, but the Grater's ice cream, phenomenal. Some of the best ice cream I've ever had.
It's 5:30 on this Friday morning when George Yang, a fifth-year resident, walks into work.
We're heading over to the resident office on the 4th floor of the hospital. That's where our team gathers every morning to sign out from the overnight resident and get ready for the day. Hey, good morning, guys.
Once the overnight resident updates the group on how each patient is doing,
Start with this really sick person.
the team splits off and visits each patient.
Hey, good morning. It's Dr. Yang with Neurosurgery.
Hey, back in from Neurosurgery. How are you? You hold both your arms up in the air?
We are heading over to same-day surgery right now, over to see our patient who's going to get surgery later this morning. And then after this, we'll sit down, finish our notes, maybe grab a quick bite to eat, and then go set up the operating room. Hey, good morning, Dr. Saligan. How are you, sir?
Big tumor.
It is huge, yeah. This is a big boy tumor.
In the operating room, residents take turns learning from each other, from the attending surgeon, and performing the surgery themselves.
The two main complications are stroke.
In addition to daily rounds and surgeries, residents also take part in a weekly educational seminar, participate in research, assist in clinic, learn in a monthly hands-on training course, and rotate call duties.
What that includes is essentially being available at a trauma center. I usually don't get a lot of sleep on call.
It's 7 years of what they say is worthwhile sacrifice.
This is probably the hardest thing that I've ever done in my life. It's exhausting on a day-to-day basis, but in those moments where you take a step back and think to yourself, it's like, I get to be part of a small handful of people in this world. You get to say, like, I'm going in to do brain surgery, I get to go do spine surgery, I get to call myself a neurosurgeon. That's awesome.
It's a record neurosurgery. Second year, it depends on which month it is. So Joel and I, my co-resident, we flip back and forth. So 1 month we're operative, the other month we're the primary junior. Can you give me a thumbs up? When we're the primary junior, we are answering all the pages, which I'm going to answer this and get back to you.
As the operative, our job is to get into the OR and really learn how to do brain surgery. Admittedly, there's not a whole lot I can do in this type of case besides help with the opening and then help with the closing. Just watching technical skills of my chief resident and my attending, Dr. Akhus, is a really good experience.
Essentially, as the primary junior, things that we do is I take care of all of our patients. I see any and all consults. Knock, knock. Hi there. Essentially manage everything. I see all the post-ops. I'm driving the AD a bunch, running around the ICUs. We're going into the surgical ICU. I think the system that we have here is pretty good. I like that I'm the one in charge of all the patients. You get a lot of learning from it. And the fact that I'm seeing all the consults, we staff with all of our chiefs before going to our attendings, which is really helpful for learning.
It's a very formative time. We're learning on all fronts and just trying to really improve each day. The fundamentals and the foundations of how to actually operate are built during this year, so it's also extremely important.
You have to have all the learning from seeing all the consults and taking care of all the patients. It's just one of the things that you have to learn and go through.
Even when things are extremely difficult and it feels like the world is falling, I still wouldn't pick any other specialty, really any other job.
Every month I feel like I'm getting better at it and understanding things a lot better.
It's difficult, it's arduous, it's a lot to handle, but I would not want to do anything else besides this.
Residents at University of Cincinnati not only learn at the region's only Level 1 Trauma Center, they spend time at 4 different hospitals. That means 4 different patient populations and 4 unique learning opportunities. It's also the region's only academic medical center.
We are the draw for the academic medical center. So unlike many other places where there's a bunch of other academic systems around and they're dividing the more complex care, this is where we see all the complex patients coming into our main campus.
UC performs more than 5,000 neurosurgeries every year. and residents take part very early on.
The residents here get a lot of operative experience early, and that has proven to be very beneficial.
We really pride ourselves on the robust operative experience that's provided to our residents.
We produce a lot of extremely talented neurosurgeons, I think because of that, because there's a lot of autonomy with our residency program.
Frankly, we're very proud of how they perform and the surgeons that they become.
Learning opportunities are always provided, regardless of the subspecialty interest of UC's residents.
We do a great job at providing them a breadth of exposure to open vascular, endovascular, cutting-edge neurotrauma, complex spine, skull base, minimally invasive skull base, functional, and then of course our pediatric hospital is outstanding.
Areas that many other programs may not have a focus in, we actually do just because it's important for resident education.
We mentioned the pediatric hospital. That would be Cincinnati Children's Hospital Medical Center, consistently ranked in the top 5 by U.S. News and World Reports. Residents spend 6 months working with pediatric neurosurgeons there. Residents also spend a weekend together each summer on a residents' wellness retreat. In 2021, the residents whitewater river rafted the New River in West Virginia and explored the nation's newest national park. Resident wellness is a big priority at UC.
We want to minimize the stress to help them maximize their performance.
Residency can be stressful, and it's very important to have a support team, and I feel like we definitely have that.
UC residents don't just support each other, they consider each other friends.
Our residents do a great job of working together as a unit. I think, unfortunately, in the COVID era, I think that it can be a little more challenging for the applicants that are out there to try and get a sense of the personality of the residents in the program.
I have a great program director, I have a great chairman, and that trickles down. That trickles down from the top to the bottom.
Our group of residents, I couldn't be more proud of who they are and what they persevere to do. And I think a few key words come to mind are things like, trustworthy, diligent, dependable, and capable.